Well, COVID cases continue to swarm the Gem State, infecting younger, healthier populations with the more contagious Delta variant, and that includes pregnant women. Now, hospitals in Idaho are reporting a rise in pregnant hospitalizations, and in some areas, a rise in stillbirths because of it. Our Katya Stepovic looked into the situation and explains more.
On Thursday, medical professionals took to the stand at Kootenai Health in northern Idaho to illustrate the grim picture they are forced to face every day inside the hospitals.
The thing that's frustrating for many of us is that a lot of these people don't need to be in the hospital if they were vaccinated.
And among the unvaccinated in the hospital are pregnant women.
We've definitely seen more pregnant hospitalized patients in the ICU. You're really taking care of two people, and I think that's a really difficult situation. It makes us all very nervous, but so far we've been lucky.
While Kootenai Health has seen good outcomes, other parts of the state, like St. Luke's and Magic Valley, are seeing concerning trends.
We're seeing more stillbirths, unexplained stillbirth, and towards the end of the pregnancy. We lost a baby that was a little too early, and this was in the intensive care unit. The entire staff in the intensive care unit was just blown away. The morale was just drained. It's kind of like, well, this felt like something good we could do.
Dr. Stacy Seib, who specializes in high-risk pregnancies at St. Luke's in Magic Valley, says in April there were around 18 confirmed cases of pregnant women with COVID. In September, that number set a record high at 150 confirmed COVID cases. Seib says the risks for pregnant women with COVID-19 are disturbing.
If you're pregnant, you're probably about 3 to 5 times as more likely to be hospitalized and twice as likely to succumb to the process and die. The thing about COVID is it causes some issues with blood clotting. And, placentas are very vulnerable to blood clots, and I think we can see smaller babies that aren't growing well. As well.
He says 97% of pregnant women who are hospitalized with COVID-19 are not vaccinated.
What is the emotional, physical, mental toll that it takes on healthcare workers when they're seeing these women come in who could have been vaccinated and really helped their situation, but they aren't, and sometimes the worst happens because of it?
I think everybody's getting very, very tired, and then when you see it happening to younger and younger people, or things that are affecting families so directly, it's very, very demeaning. I mean, it's like where are we going? And the question is why?
Do you have any women saying, when can I get the vaccine now that I'm in the hospital?
Yeah, we have had some people say, yeah, I think you're right. It's time. I really appreciate moms worrying about what they're putting in their body and how it's going to affect their babies. But I think the vaccine itself, it doesn't really cross the placenta as the mRNA part of the vaccine, but it does create antibodies that will cross the placenta and help protect the newborn baby.
Dr. Seib worries that the situation could get worse during the colder months. So now is the time for not only pregnant women, but for everyone to get the shot.
Get a vaccine, please. It seems like a scary thing, but it's the best thing that's going to protect both you and your baby. And I don't know how to reassure people any more than that.
Katya joins us now. And Katya, I'm curious, for newborns whose mothers were infected with COVID when they gave birth, do we know if there's any, side effects or consequences there?
Well, there's obviously, like we heard, the risk of the baby dying when the mother is pregnant and giving birth and also has COVID-19. But the chances of the newborn getting COVID from their mother is actually low. Obviously, it's even lower if that mother is vaccinated, and that's according to the CDC. But when a pregnant woman is hospitalized, like we heard with COVID, like you heard Dr. Seib say, there's actually that risk of the baby growing at a slower rate. So that's fascinating new information. But again, there's still a lot more to be done on researching the impact on these newborns.
And I know that you're following that for us, so we'll update as that information becomes available. Yeah. Thank you for joining us, Katya.